All right, so we are discussing here how how the patients how the EMR essentially should be organized, and so now we're going to talk essentially about the other components of the patient's actual chart. So just to give the overview here, back at the beginning, what we're looking at is in the patient view, we are going to have their dashboard, and then we'll have sections for the profile, care plans, financials, appointments, encounters, and documents. So this could be organized in any usable manner. I'll show an example here as soon as I get back to my spot. Okay. So basically what we have here is a description of everything that should be contained in the patient profile. So this could be something where, so these icons are much bigger, and this doesn't depict the dashboard, but we could have small icons, but essentially we'd want an area where we have the profile data, but with the data specific to what we're requesting is listed right here. And there is an identification aspect of that, as well as an administrative. In a moment, let's see here. I guess right now is a good time to discuss fee schedules. One of the big challenges that we have had with other EMRs is the total inability for the fee schedules to be intelligent enough to understand what's going on with the patient case. And so the patient's ledgers and fees end up being wrong almost 100% of the time, which is very frustrating. But in an office like ours, often the patient is utilizing different types of benefits, which may have different limits, different deductibles. So as a result, they might be paying out of pocket, like on a patient pay time of service fee schedule for chiropractic, but have benefits for the medical component, or they might have benefits for medical and durable medical equipment, but a limit for chiropractic. So after a certain number of years, the system basically needs to be smart enough to know when insurance is expected to pay and what to charge the patient if not. And so what would be beautiful is if we could develop the fee schedules to be automated, and basically this is a document that defines how all clinic services, procedures, and items are priced and billed using service domain, fee category, and coverage state. So this supports dynamic pricing, payer overrides, and switching between insurance and cash packages and audit trails. So essentially, we are going to provide a fee schedule that links each item to a service domain, and a patient fee category will be assigned based on the type of patient. So we do have special fees for employees, reduced fee schedule for friends and family. Time of service is what patients pay if they have to pay out of pocket, and the standard fees are what we send to insurance payers and personal injury. And then essentially, certain services are covered or excluded from being paid by insurance. And basically what we want the program to do is to default to the standard fees for any service that we believe will be covered by insurance until that benefit is exhausted or excluded. At that time, it'll switch to time of service fees or a package the patient selects until, for that domain only, until the benefit renews. And this should allow one-click override with an audit reason. And so we have definitions of what I just discussed, and here are the fee categories. So those fee schedules here would be one that we would select as far as the staff, employee, or friends and family, or time of service. Now, patients who have insurance may be going back and forth between the time of service and the standard, depending on how their benefits work. And so we will provide the different pricing tiers, but essentially we want the program to know that if the domain is covered, it's going to apply the standard fee, and it's going to switch to time of service when the service is excluded by the payer or exhausted, or authorizations required or missing, or if patient chooses package or cash option. And so package pricing is going to override the time of service pricing, and there are certain never covered items that will always be time of service and not get sent on a claim. And this is just further discussion. And explanation here. We also want the system to keep up with payer-specific allowables and to keep fee schedules so that the system can begin to learn what different insurance payers are expected to reimburse, and that helps with reporting and everything like that. I'm not sure if this coding information will be helpful or not. I was obviously working with Chet to help develop this. And so what we want to do, as I mentioned, is have on the back end a payer fee schedule that is updated all the time with real-time data from EOB or ERA information coming back from the insurance company. And so this will keep basically an updated fee schedule for every service for every insurance payer so that our system and our clinic, and so we have references to have very good predictions about how much we're expected to collect. All right, so that is the deal with fee schedules. So I presume that, I guess during the file setup, presumably, at least if it's staff or friends and family, I guess those would be the ones to choose, but otherwise the system should default either standard or time of service, depending on the patient profile. And then we need all of the other information there as well. And then in the profile, it's great to have a billing snapshot of basically all the financials. That'll be read-only in that area, but it'd be great to also have high-level status badges like card on file, verification, auth required, as much information as we can get there at a glance. And then the next section in the patient chart should be care plans. And I'm going to, in a future video very shortly, describe exactly how care plans should work, as well as give you resources on our protocols so that those can be preloaded into the system as a basis to start. But care plans are basically going to be tracking everything from the justification for the program order to the whole execution of that plan with the patient, and we'll tie in the financials and the education and the labs. We should be able to see current and past plans, as well as protocols and timelines, linked visits, linked consents, and linked lab and supplement tracking. The next section is the patient financials. We want the main view that opens to show the ledger. We're going to have an expanded ledger that allows us to filter to look at only care plan charges, recurring charges, insurance charges, payments, and then a whole integrated ledger. So each of those views should be visible on its own, and I will try to come up with a ledger demonstration if you need more clarity. But essentially, when patients sometimes are prepaying for care plans, for instance, they might prepay for 12 B12 injections that we then owe them and will deliver over time. but they might have a reoccurring monthly charge for a medical weight loss program. And they might also have then daily copay, coinsurance, deductible amounts, or time of service fees linked to other visits that they come for. So keeping all of the financials straight and understanding what balances are owed on different programs, what services have been prepaid for, and what services remain to be delivered to the patient is very important. I had thought that would be nice is if we could have and this isn't a perfect illustration, but it might give you an idea. I'll have to come back to this. This keeps logging out. All right, so this gives kind of an idea of how the ledger can be tabbed, although again, we do want an integrated tab, but we want to be able to see care plans from recurring charges, from payments, from scheduled payments, all in different tabs are fine. And then basically what we would like either on a sidebar in the ledger window or along the bottom, but the other components of this financial portion of the chart is going to have the area we would enter the payer, or we would basically enter the payer type, whether it's patient pay, personal injury, or insurance. And we would then, I am going to have to tell you some specifications about our insurance billing. We have certain payers that require that chiropractic claims go one place while medical claims go another. In some instances, durable medical equipment goes to another. So hopefully we can give you these hard rules, linking essentially the service type to where the claims are delivered for certain payers. So I will get the payer rules over to you, but we need to be able to see and edit the insurance information. We need to view insurance verifications that have been performed with reference numbers, pre-authorizations that have been submitted and are pending and received. We should have a link to claims, a link to the payment method, and a link to statements. So that could be this sort of thing where those are blocks along one side or the other, or folders, but that would be everything we need in the financial section. We need an appointments and scheduling. That is going to help us to see the patient's upcoming appointments, past appointments, along with the visit type, provider, location, link to encounter, no-show cancellation tracking, and also delivered appointment reminders and communication logs. And it's important when the staff is scheduling appointments that we offer a lot of flexibility. For instance, we would like to be able to schedule a patient for one time, the time they would arrive, and have the system strategically plan the best order of services based on our schedule. So I will provide more information about the appointment and the appointment's rules very shortly, but that would be the appointment section. Then we have the encounters, which are the SOAP notes, and this is also where we're going to have a link or a folder for all of the education that's been ordered and received, all of the treatment that has been ordered and received as far as the written orders there. That'll tie in when I go through the new patient assessment, how those orders are created. We would have a medication section that shows what was ordered, filled, as well as the current med list. For supplements, ordered and current list. Diagnostics, ordered pending tests, that would be labs and imaging. We want to see what's ordered. We want to see the results, the interpretation summaries, and the retest tracking, as well as referrals that have been sent. And I may want to make a note here on the diagnostic. The lab and imaging results should basically be housed in the encounter section, but hard copies, basically the document file should be simultaneously stored in the patient document section. So there's a little overview of how that should function there. And this gives some really nice AI help for the provider here. And now I have a little section here about medical orders. So every treatment administered must have a written order in the chart note, which should include what is being ordered, why, and the rationale, when, how often, if it's recurring, as well as a follow-up plan, which might include a re-exam or a recheck. So we basically need the system to be smart enough to understand that this is a process-driven method by which we document a complaint, diagnose a patient's condition, and essentially order, assign diagnosis codes, order treatment, order supporting imaging or labs as needed, and get pre-auth as needed, but it's kind of like a systematic workflow. So orders need to be in place for every treatment that we administer. Letters of medical necessity are needed just for certain services. This is when a payer, pharmacy, or supplier demands that written justification is provided. Usually this is for a pre-authorization, most commonly for durable medical equipment or a pre-authorization request or for appealing a denial. And some of the most common services that we might need a letter of medical necessity created for might be peptide therapy or IV infusion, specialized labs, often antifungal or antiviral courses, durable medical equipment is probably the most common. Imaging, compounded prescriptions should have a letter of medical necessity. Patient programs like the BioRestore, GLP-1 medications. And so basically, we need the system to be programmed to detect when a letter of medical necessity will be needed based on the item or CPT category. And we basically should have it, we should be able to prompt a letter of medical necessity to be created, or it should be suggested when it's apparent that it needs to be prompted. And then in our document section, we're going to have HIPAA forms, consent to treat, financial responsibility agreements, release of information, service-specific consents, incoming records, outgoing records, and then we'll actually have diagnostics here as well. As far as labs and imaging, we could have those in separate folders or together. Either way, the patient ID is the universal key connecting all modules. The ledger should read from billing engine and should incorporate incoming data from the clearinghouse. The statements should pull data automatically from the ledger and have correct balances. And let's see what else. I'd already talked about the intake wizard in another video. So aside from that, we talked about fee schedules. I'm going to provide a universal letter of medical necessity that the system can use to auto-template those letters that need to be made. And then finally, for right now, this is how our patient documents should be set up and the auto-linking rule. And we basically wanted to just make it intuitive as possible and to make sure that AI auto-links the encounters with the insurance submissions and the supporting evidence, and that everything that we have preserved version history for medication supplement changes, pre-auth packets without clutter. This gives an example root structure of how the charts could be set up. And this gives an example of what would be in each folder. And also then goes on to talk about naming rules. And so, and then also we want encounters to be auto-linked to any labs or diagnostics that were reviewed that day, any related pre-auth submissions or letter of medical necessity, any paper forms that had to be used that day for durable medical equipment fitting, and it should suggest the attachments and allow the staff to finalize it when we're finalizing the encounter, just in case there was a document that did come in that wasn't received or vice versa, or if a patient brings a document. And a lab or imaging report can be linked to multiple encounters. And basically, anytime that we get labs or imaging and go through results, the system should prompt automatically for us to confirm whether follow-up is necessary, whether this test will be repeated, or whether the test is considered performed and done. And then basically an encounter sign-off, the system is going to generate a file that's going to summarize all of the linked docs. And this is a little more information about the medication and supplement management. We always want to have a current list, but also a permanent history trail. And so this explains how we would keep those, as well as automations to implement. And also we need to discuss in more detail how the system is going to auto-import and sort documents and images. We have images and documents coming in from a variety of places, and we just need to find out if you're going to do that through the laboratory website or portal interface, for instance, or if we need to come up with a different plan. But essentially, we want to make sure that those are coming in and being sorted and put also in the work queue for providers to review. So that is everything on that. Let me just make sure. We talked yesterday about the calendar layout. I will be providing a list of appointment types very shortly. So I'm going to be providing our fee schedule, our appointment types, the new patient flow process explanation. I'll give, you can let me know if you need more examples on how the ledger should be laid out, and we'll also get you our protocols as well as our special payer rules. So please let me know what else you might need at this time. Thank you.